Hi guys, my name's Fee. I'm a physiotherapist working at Injury Active. In this video today we're going to go through lots of ankle rehab exercises. So for those of you who have recently sprained your ankle, you've just come out of that acute phase, or for those who have recurrent ankle instability, so repetitive strains in the ankle that just keep happening and getting worse and worse. So obviously when you roll your ankle, you stretch all the surrounding tissues, the ligaments, and you cause a little bit of damage. You then normally result in some joint stiffness, muscle weakness, and lack of proprioception as well. So in the exercises today, we're going to go through some early or more beginner exercises that start looking at range of motion, strength and balance, and then we're also going to show some progressions as well when you start to see that improvement. Okay, so exercise number 1. What we're going through here are some parallel knee bends. So this is where you're simply standing with 2 feet shoulder width apart, and all you're doing is letting your knees come forwards and you're sending them over your toes, and this is just getting that kind of dorsiflexion range back. Once you've done this, you can then progress to single leg. So you're going to stand with one foot in front of the other. Your weight's going to be on that front foot, and this is the foot that we're trying to work on getting the range back. The back foot, you can elevate the heel, you can do whatever, as long as the weight's more on the front. And then all you're going to do is the exact same movement. So you're going to send that knee over the toe, and you're going to take it to end range with this. So really try and push it to where that limit is felt and then back away again. So we're not looking for pain, but we're looking to kind of increase the range and push it further than it normally goes. Exercise number 3. So this is just some basic range of motion work. You can do these in sitting or you can do them in standing. All we're going to do here is practice pointing the toes down like a dancer and then bringing those toes up towards your face. So these are going through plantar flexion and dorsiflexion, and then going side to side, as well as doing some circles. And this is just getting some light movement, blood flow and range of motion work at the ankle. So the next phase that we're going to look at is strength. So early strengthening work, we normally do isometrics. So isometrics is where we're getting the muscles to contract without actual movement occurring at the joint. So you can do these with the pressure of your hand, resisting all the movements, or we can do them using resistant bands. What I'm doing here is I'm using the TheraBand, I'm holding it with my hands, and I'm pointing my toes down against the resistance of the band. So you can do these with just holds, or you can move through up and down reps. So here what we're doing is working banded inversion. So I've crossed my legs over to make sure that the exercise is working the right muscle. We're not compensating using the hip. We're going to have tension on the band and we're going to loop it around the foot. And what you're doing there is bringing your inside of your foot up towards you, taking it into inversion. Progressions from the banded plantar flexion, which is where you're pointing your toes down, are heel raises. And for these, we're going to go over to a wall. Again, starting with 2 feet to make it nice and easy. You can either do 50-50 or you can bias less weight onto that ankle and then gradually build up. So you're going to start with 2 feet and all you're going to do is rise up onto your tiptoes, pause for a second at the top and lower back down. Progressions of these then include going up on 2 feet, turning over onto 1 foot and lowering down. And again, we're aiming to be nice and slow and controlled with all of these. So rising up on 2, shifting over to 1 and slowly lowering. Again, from here we can push this on to doing a single leg calf raise, which is all the way up on 1 foot, pausing and lowering back down. So when this then becomes too easy, we can progress this on by adding a little bit of a deficit. So you're going to start on the bottom of a step, let the heel drop down so you're getting a nice stretch on the calf, and then you're going to rise back up onto your tiptoes, pause for a second and lower back down all the way through range, so letting that heel drop down. The next exercise is the reverse of this, so we're going to work on dorsiflexion. So we're going to turn ourselves around onto the wall. Again, depending on how much body weight you want to put through, walk your feet in or out. From here, all you're going to do is pull your toes up towards your face, pause and lower them back down. And again, you can vary the amount of time that you're holding that top position and making sure that we're controlling it all the way back down towards the floor. The next phase we're going to focus on is balance or proprioception, and we're going to start quite simply with just a single leg stand. So those who find this too easy, you can add in a slight distraction, so catching your ball or reaching for something, or you can close your eyes, which again adds in a different variation. The next phase of this is pushing it on to toe taps on that single leg. So you're going to balance on 1 foot and you're going to reach your foot around a clock face. So imagine each number on a clock and you're going to reach your other foot as far as you can towards those points, trying not to put your foot down in between. Further to this, a more strengthening based balance exercise is a single leg deadlift or a single leg RDL. So you're going to stand on that ankle, again get your balance Lean your torso forward and you're thinking about a hip hinge movement, so you're going to send your hips to the back of the room as you try and touch the floor or lean downward towards the floor. Again, bring yourself back up, and the aim here is to keep good balance throughout the whole movement and try not to put your foot down in between. Progression of the single leg stand is to do it on an uneven surface, so you can either use a Bosey ball, an ankle stability ball, or again just pop some cushions on the floor. And all you're going to do is start simply with that single leg stand and progress to adding those distractions back in. Final section we're going to work on is plyometric work. So again, this is a little bit more sport specific, but we're looking at loading the ankle up. So we start with two-footed pogo hops. So just springing up and down on your 2 feet, trying to make yourself as light in area as possible. And then we can drop down to a single leg hop. From here we can start to add in a hurdle, so you can hop side to side, forward and back, over the hurdle, trying to increase our height and accuracy. A further progression from here is to do compass hops, so you're going to try and land in the same spot each rep, and you're going to hop to each point on the compass, trying to remain nice and light but landing with good control. Try not to put your foot down in between each rep. So in this exercise, what we're doing is practicing the landing phase. So you're going to find yourself a step or a plyo box, and all we're going to do is step off and control the landing. So step off either foot and then land with a nice solid base. Don't let that knee drop in, and control the landing. Again, to progress this on, we can add a spring at the bottom, so you're going to step off and immediately spring back up into the air and land. Okay, so I hope that helped, guys. If you have any questions or problems at all, please don't hesitate to get in touch with us at Injury Active.